Hi folks, this is Dave Sheehan from The Connect Show. I'm very excited to have two guests on the show coming up with this episode, Kel Cates and Cathy Ryan. Now together, they produce what's called Massage Therapy Without Borders, which is a fantastic podcast, which sort of grew from the beginning of COVID times. So stand by, it's going to be a great episode, great interview. See you soon.
In this video, I'm going to talk to you about different types of spondies that relate to the vertebral column. Typically, we've got degenerative changes that is known as a spondylosis. But think of the word first, okay? Spondy means the spine. So when you have a spondylosis, then it is going to be basically an osteoarthritis of that particular vertebra. In the lumbar spine, spondylosis tends to be around L4 and L5, and also L5 and S1. People who are 20, 30 don't generally get osteoarthritic changes. It tends to be more as a person gets older. And there's many reasons why that would be. So for instance, like the discs, they become dehydrated, so the space will get less. The facet joints around this sort of area where the blue is located. Okay, so this is like the facet joints here. So this would be the L4 facet around here. So this is the superior. And then if I take that off, then this would be the L5 superior facet that will articulate with, what have we got in here? Let me just bring this back in. There we go. Just trying to work that out then because one side is missing. So we've got the facet joint of L4 inferior facets. So a lot of time they can actually become deteriorated and degenerative and then cause a lot of pain because they tend to get bony spurs called the osteophytes. In the cervical spine, it tends to be more C4, C5, C5, C6, and C6 and C7. So typically 3 levels in the cervical spine, and then in the lumbar, 2 levels. Now, if you have a spondylitis, then there is a particular condition called ankylosing spondylitis. And ankylose means to fuse, spondy is spine, and itis is inflammation. So we've got a spinal inflammation, eventually becomes a fusion. Typically, the person is male, more often than not. It's normally between the ages of 17 to 40, give or take. And it normally starts off in terms of pain in the bilateral sacroiliac joint. So the left and right SI joint is where it tends to start. Pain might not be the correct word. The young male tends to wake up every morning with a bilateral stiffness around the SI joint. And then after 20-30 minutes, it tends to ease off. They don't really know why it's caused. Okay, so it's a disease process. And then they would have a blood test to confirm, and the blood test is known as a HLA, which is a human leukocyte antigen B27. So then that would be the test, and it's around 90% positive for AS or ankyspond, or medically known as ankylosing spondylitis. So it starts off in the SI joints, and slowly over time it migrates and causes the long ligaments, like the longitudinal ligaments, and the disc to slowly ossify. So as it progresses through the lumbar, thorax, cervical, it ends up looking like a bamboo spine. So the 23 discs become one fused bone. And when you have an X-ray, it looks like a bamboo shape. And it's through a process called enthesopathy. You might also get pain around the greater trochanter because that is like the enthesis on a bone. And maybe like an Achilles tendinopathy, where it attaches. So it can have other issues, and also an inflammatory issue with the eye as well. So ankylosing spondylitis is an inflammatory joint disease that eventually becomes a fused spine. Now, another 2 spondies will be a spondylolysis. Now, if I just take off, this is L4, and if you look here, you can see there is a fracture either side. And if you have an X-ray from the side, like an oblique X-ray, This is known as a spondylolysis. So the word lysis, okay, so a spondylolysis means a defect or a fracture, and it is to what we call the pars interarticularis, which is the anatomical area, in particular to the lumbar spine. Typical in fast bowlers, yeah, people where they do a lot of extension rotation, maybe wrestlers, gymnasts, and so on. But it tends to be in that the male, if you like, yeah, who is throwing a cricket ball because of that extension rotation, and it loads the pars and it can cause a defect to it. If that's the case, then it can, if you have a bilateral lysis here, okay, then it can cause the vertebra to slip, and suddenly now we've got a what we call a spondylolysis. And the lysis means that we have a slippage. Typically this would be L5, even though in this case it's L4, and then if it travels anteriorly, then it's graded. If you're looking at the vertebral body, so 25% of the anterior shift will be a grade 1, 50% will be a grade 2, and so on. If you're looking at it from an oblique angle here, all right, then it looks like the shape of a Scotty dog, like a little dog. So if you're looking at the shape, you've got his head, his neck, okay, so the body here, okay, the paws forward and so on. You can see it with a collar on. And then if we have a slippage, you can see that now, you know, think about it, okay, so the head's now come off along that sort of area, so you can see that. And then if it does, so that would be L5 spinous process. If it does slip, then it allows L4 to drop forward, and then you'll have what we call like a step. So when you palpate L5, you can step down onto L4. So what we've covered will be a condition called a spondylosis, which is a degenerative spine, spondylitis, which is an inflammatory spine. We've got a spondylolysis, which is a defect of the pars, and then if it causes a slippage, then that would be known as a spondylolysis. I hope you enjoyed the presentation, and thank you for watching.
Hey folks, Dave Sheen here from the Connect broadcast show. Really fantastic two guests here today. We've got one from Canada and one from the States. We've got Kel Cates and Cathy Ryan. Welcome, guys.
Hey, thanks, Dave.
Yeah, glad to be here.
It's thank you very much for coming on the show. It's something that we've been wanting to do for a little while, since you guys actually interviewed Anne Davey, our CEO. Now, Anne's been reaching out to lots of people around the world to try and sort of bridge those gaps between different parts of the world. And we're trying to sort of work out what everyone's doing in the massage industry. But first, before we do that, how are things going with COVID over there?
Scary.
Scary. Yeah, they're going in the States. They're definitely going up, and we've got the whole vaccine just melee is the only way I can really describe it right now. I'm hoping that in a month or two it will be less like that, but yeah, there's just a lot of panic, and it's all really kind of rolled up with our administration and the political changeover that's about to happen. So ask me that question again in a month or so.
What about you, Cathy, up in Canada?
Well, we do not have the population size that the U.S. has, where our population is about equivalent to their state of California. So, but still, certainly numbers are up in this what we're calling the second wave here. We don't have the same kind of political turmoil that is obvious as the U.S., but we still have a lot of the same issues, COVID and otherwise here.
Yeah. And just before we started our interview, Cathy, if we can get on to who you are, what you are. Obviously, for people that know what I do back here in Oz, you're very familiar with fascia, and you're very passionate about it. So did you just want to give the folks at home a little bit of your background? It was interesting because we had a little laugh in the beginning, because I didn't really want to read out your bios because they just go on and on. You guys have done so much. So you're going to give us a nice summarized version. So over to you.
Well, that's what happens when you've been around for a long time, as I have. And
That's true.
you find a lot of things in massage therapy really interesting. So I am a registered massage therapist. I'm here in British Columbia, Canada. And I think the quick who am I is I'm obsessed with fascia and I love Heal Well. To broaden that out a little bit, I am a massage therapy clinician. I have a private practice. I am a massage therapy educator, author, and writer. And most of my writing, a lot of it is focused around scar tissue and fascia. Those are kind of my passions as a massage therapist. And I teach a variety of different formats, online and in person. Again, mostly a lot of interest in fascia, but scar tissue has become one of my things.
Fantastic. And we'll switch and swap around here a little bit, but some of the guys back here in Australia would be aware or have met Leslie from ABMP.
Yeah.
And
Yes.
and our association has an association with their association, for a better word. So our members are getting discounts for the online course portal. So you do have a scar tissue management 3-part series on there. Is that correct?
That is correct, along with my dear friend and colleague, Nancy Keeney-Smith, who I co-authored the scar tissue management book with. We have a 3-part series for ABMP. And for the other fascia nerds out there, I also have a 5-part Exploring Fascia series available through Heal Well, their learning management system.
Okay, fantastic. Well, since we're talking, that's a good segue over to Cal, yeah, with Heal Well. So Cal, did you want to explain your journey in the massage industry over there?
Yeah, absolutely. My name is Cal Cates, and as a side note, or maybe not such a side note, my pronouns are they and them, which is a struggle for some people. But so later on, when you guys are talking about how you saw Cal Cates, you can be like, Cal Cates, they're amazing, instead of she's amazing or he's amazing. So happy to talk about that offline if anybody has questions. But we've been talking a lot about how to advocate for all kinds of patients and people in the healthcare setting and in the world. And that is one of the small ways that I get to do that. So I've been in the massage field a little, not quite as long as Cathy, but pretty much just dove in with all 4 paws from the very beginning. And I feel very much that massage has just been an avenue for me throughout my life. I've really found myself in places where social justice and kind of working on behalf of the underdog is something that I did, working in rape crisis and, domestic violence shelters, and then finding my way to massage therapy. And then specifically within massage, working in oncology massage and end of life care, and just these things that sort of find themselves on the margins unnecessarily and inappropriately. So yeah, just really working to change the way we talk about what we do, and to really help massage therapists move away from what they do with their hands. That's super important. But our real opportunity to cultivate ourselves as providers and fellow caregivers, or carers, as you guys often call them down there, it happens inside us. And that's a lot of what we do at Heal Well, which is an organization that I founded in 2010. And we really, everything we do is geared toward creating complete practitioners, whether it be massage therapists or people from other disciplines, really working together and bringing together massage therapists with nurses and physicians and social workers and other providers to share what we've learned and what challenges us about caring for people.
Okay, fantastic. Now, you wrote an article, I think it was called Death, Dying, and the Breakability of Us All.
Yeah.
And that was nominated as sort of an award-winning article. Is that correct? Did you want to talk a little bit about that? Because the whole oncology, I guess, platform for massage here in Australia it's building a lot of momentum. And as our association, there are certain focus points that we're looking at as far as, I guess, promoting massage into different areas in a more strong way than what we have in the past. And that's one of the areas that we've been looking at, elderly care as well. But yeah, so the end of life stuff. Did you want to talk about the article? That sounded really interesting.
Yeah, it was a couple years ago, and it really it was a great opportunity. I mean, I any chance I have to partner with ABMP and their publications is a lucky chance. So, but to really write about why it's important for us as humans, but certainly as care providers, to really become to develop a meaningful and honest relationship with our own mortality. And particularly, I think when we're working with oncology, we're working with the elderly, we're working with people who circumstance has made it impossible for them to pretend that they're going to live a long time, or at least makes them more aware of their mortality. And I think so many people are drawn to working with the populations we just talked about because they want to help, and because without even knowing it, they want to sort of take care of their own suffering. So the article is really about how, in order to be a truly present caregiver in situations of suffering, we have to get really familiar with our own suffering, and whether that be living with a chronic illness or just living in this really breakable body that, even though this moment it feels really healthy and it does what I ask it to do, at any moment that could change. And that part of what makes people go, oh, oncology massage or hospice massage, I could never do that, is that what they imagine is that they're going to be looking in this strange mirror that they don't want to look in. That when you sit at the bedside of a person who is dying or is challenged with some serious health condition, some part of you knows that this could also happen to you. And so it really is just about inviting people to consider that a lot of what we do in caregiving is actually about control and about trying to keep a distance between us and that suffering, and that the real meat and our real ability to be of service comes when we say, oh, I could be you and you could be me. And I don't know any more about this than you do. This is both of us. This is our first time being with you on this journey. And you've never died before. I've never died before. Maybe I've worked with people with MS or ALS or whatever it is, but I've never worked with you. And I've never worked with you at 10:30 on this Tuesday morning, and so really being.
It's a point dear to my heart too, because I remember my pivot in profession was based around my mum getting cancer, and the touch side of things was, it was profound, the way it could have effect on her, but also our relationship too, because of that touch as well. So
yeah,
I dig what you're saying. Absolutely. Yeah. It was a big moment for me, which got me actually into massage. So,
oh, wow.
Great. Yeah.
Well, and I think as an association, I think the other challenge for you all is that not every massage therapist belongs in a clinical setting. And part of what HealWell does is to connect those dots, because there are things to know. There are mechanical things, pathophysiological things, there's science to also understand. And we want to cultivate providers who can bring all of that to really create integrated care. And that's, I'm sure, as an association, you want massage therapists representing the profession well, and that's not always the easiest thing to do.
Absolutely.
Yeah.
Now, Cathy, we better wake you up over there. We haven't asked you too many questions. Hey, let's talk about fascia for a minute. So you were in it from the beginning, as far as when things started taking off. Interest became like it just built from nothing, right? So once upon a time, the anatomy books, and most anatomy books still don't really represent it that well. There was basically nothing. It was bubble wrap. It was wrapping around different organs. Wow, how amazing! But then people started to investigate further. So were you a part of that sort of groundswell in the very beginning?
Well, way back in the late 80s.
This is the thing. It's
way
not
back
that
in the
way
late 80s
back,
when I went to
really?
massage therapy school.
Yeah.
I mean, what we knew about fascia were a few plates in Gray's Anatomy, and that was pretty much it. I fortunately had an instructor who had just done his training at the Guild for Structural Integration as a structural integrator / Rolfer. So he was talking about this mysterious tissue. But because we were in our entry to practice massage therapy education training, he didn't get into a lot of depth, but he certainly piqued my interest. And then, get out into practice, and, it's going well, but I found that, certain outcomes were not sustainable. So then it's like, okay, why that same trigger point is back week after week after week. And so then that got me exploring more. And there literally was nothing out there. I couldn't find anything. I found an autobiography of Ida Rolf in the local library, but nothing about the tissue that I'm working with, and then fast forward to the early 2000s when Robert Schleip created his website, somatics.de. Somehow I discovered it, and he was one of those individuals who was sharing, which was very unusual in the Rolf community at that time. So he was sharing information. So I started following his stuff. And then, of course, in 2007 was the very first Fascia Research Congress, which I attended in Boston, and that just blew my head off like everybody else there. And at the time, I was already a featured writer for Massage Therapy Canada magazine. So I just started taking the deep dive into the new discovery of fascia from a manual therapy perspective and from a science and research perspective, and just started to translate some of that information for my massage therapy colleagues here in Canada. And that's kind of what really began the odyssey for me. And I've been to every, fascia congress since, except for the one that was in Amsterdam. I couldn't make that one. And then I've had the great privilege of presenting a pre-conference workshop at the last one in Berlin. And of course, I'm going to be headed to Montreal in 2022 for the next one. And then just devouring all the information I could find, and closely following people like Gil Hedley and Robert Schleip and many out there's in the who's who of fascial. Jean-Claude Guimberta, who's one of my it's interesting listening to Cal talk. And I mean, we co-host a podcast together, and much of our philosophy of care is very much in sync, which is, kind of why we like to hang out together, and it kind of occurred to me that it's so interesting because Cal comes out of the gates, guns blazing right in your face with therapeutic relationship stuff, which, I feel just as deeply as Cal about. That's so much, such an important part of what we do, as important, as valuable as what we're actually doing with our hands. I come at it a little bit more sneaky. I lure people in with chit chat about sciencey stuff and what my hands might be doing. And then
it's a more Canadian approach.
I've got
Cathy,
them corralled, and then I can talk to them about therapeutic relationship and social justice and equity in healthcare.
That's right.
You've just stolen my perfect segue into massage therapy without borders. I reckon you'd be good at doing a podcast or something like that. The way that you just segued across that was very impressive.
Yes.
So now we are talking about the podcast, and this, being the sort of the age of global access to everything. Everyone at home in Australia certainly can access the podcasts, and I've had a little sample. I was just talking to Cal and Kath about listening to their interview with Gil Hedley, which I think you just mentioned, Gil, before. Did you want to talk about some of the guests that you have had on? You've had Anne Davey, which is great, our CEO. So I actually haven't heard that one. I don't know what you guys talked about, but it seems that it's a really laid back format, which I think suits Australians as well. We don't try to get too tied up in the vernacular. So it's good that you guys are putting this out, and I think for everyone at home, it's worthwhile tapping into and having a look at. So you can access it through, I assume, through like the app stores. Is that right?
Absolutely. Anywhere you get your podcasts, our producers done an amazing job of putting it all over the place.
Okay. And how frequently are you putting a new episode out?
We roll out once a week for the most part. And it was really important for Cal and I. We really wanted organic conversation. We do not have scripted, pre-planned questions that we ask people. We contact people who we think are interesting and we know to be leaders in the industry and are out there doing amazing things. And we have sort of a general topic that we're going to talk about, but then we just let the conversation roll.
Okay, fantastic. So some of the people that you've had on the show, apart from Gil and Anne.
Yeah, well, we've had, let's see. I mean, we had so many interesting people. We had Sue Bibick, who has owned a massage school in Kalamazoo, Michigan for almost 40 years and was a math teacher before that, and just has such a fascinating way of looking at the world. And We had Celia Bucci on to talk about, well, a couple times actually. We had Celia on. The first time we had her on, we had so many other exciting things to talk about that we brought her on to talk about how to teach cultural competency, but we didn't even get to it the first time we had her on, so we had to bring her back. Yeah, we had Dr. J Pop on, who is a African American physical therapist, practices in Philadelphia, talking about allyship and what meaningful allyship means for white providers, and just kind of how to get out of our own way.
Yeah,
I think, yeah. And go ahead.
Did this actually start sort of COVID time, or has it been going for some time? So it was sort of self-care stuff for you as well to be actually.
Well, it was kind of a dare, actually.
Oh, okay.
Cathy tells the story better than I do, but.
Well, we here in Canada, like many parts of the world, we were told to suspend our practice back in March of 2020. So after about 3 weeks of that, I was going a little stir crazy. So I sent Cal an email and said, "Hey, you guys are shut down. Maybe you have a little bit of spare time. Why don't you start that podcast that you've talked about before?" And then Cal quickly responded to me and said, "Great, we're going to co-host, right?" And I was like, Oh, okay. No, I thought maybe you were going to do the podcast. But so, we started out wanting to talk about COVID because a lot of massage therapists were juggling, working, not working. Should I wear a mask, not wear a mask? What should I do? How do I protect the people coming into my practice? How do I protect myself? So we really started out just having conversations about COVID with a variety of individuals who could shed some light on some of this information. One of our guests was Dr. Danelle DeGowan, who is a Canadian massage therapist, PhD in epidemiology, who came on to talk about, some of the aspects of COVID. And one of my dear friends and colleagues, my beloved Pam Fitch, who is our queen of therapeutic relationship. And, so we've had a number of people in the early days, with somewhat of a focus on COVID. And then it just kind of started to branch out from there. And we've had all kinds of interesting folks, which then led us to, we started out as Massage Therapy Without Borders, but we were starting to get so many interdisciplinary conversations going that we've now done a pivot, as Cal says, and have renamed the podcast. So for those of you that are out there in 2021, we are now hosting the podcast called Interdisciplinary.
Oh, okay. You sort of cut out there a little bit. Was that
It's called interdisciplinary, and we'll have providers from all different disciplines, and I think we'll stick with our global approach and bring folks from different countries, and just really trying to find the common ground as people who care for people for a living. Where are the places that we can come together, and where are the places we can learn from and with each other, and continuing to take on the hard topics. I mean, I think part of what caused us to shift midway with Massage Therapy Without Borders, I mean, it's unfortunate to say, but when George Floyd was murdered, people became really interested finally in talking about racism and inequities and the things that have, challenged our world for centuries. And where, before, I think if you bring that into a regular conversation, you're the downer, or, if you want to talk about that, you go to a specific place. But it's really clear to us that these conversations are public health concerns, that this really is about healthcare. And so we felt like, well, people are listening to this thing and they're sending us questions, and we're having questions in our own lives. So let's really bring people on who want to say the unpopular things and ask those questions. And let's really figure out, as humans, how to move forward and be part of the solution.
Yeah, fantastic. I was going to ask you about Heal Well as well, because that's where this whole concept sort of grew from. I think you touched on it very briefly, but Heal Well it's a not-for-profit, non-profit. And did you want to talk a little bit about what sort of the aims of the associate or the organization are? Because you've mentioned just a couple of things, but I think me reading into what I've seen about Heal Well, there's a lot more to it. So it'd be interesting for folks to know.
Yeah, it's really, we just had our strategic planning retreat with the board of directors, and one of our
Perfect
struggles is
timing.
that, we don't have an elevator pitch exactly because there's no building tall enough to kind of get all the nuggets in. But, our mission is to improve quality of life for people who are affected by acute, chronic, and serious illness. And we made it broad like that because everyone is affected by acute, chronic, and serious illness. You may not be personally living with it, but it really allows us to serve all kinds of different communities. And, we do some work with people in the local jails. We work with the local clinics. We work with, we were supposed to launch right before COVID, a program with the homeless shelter, as well as doing hospital-based palliative care massage and oncology in the pediatric hospital. And we really, as we started to do that work, it became clear to us that our real champions and the people who are really going to move this needle aren't massage therapists, because if you're selling a product, nobody quite believes your pitch. Somebody else has to say, I've worked with these people and they're the real deal, and we need to get
The
them
testimonial. Yeah.
Exactly. So we needed
yeah.
social workers and nurses and physicians who had seen our work to advocate on our
Endorse.
behalf. And
Yeah,
we
yeah.
really developed those collaborations over time. And then we saw that we're all dealing with the same types of compassion fatigue and burnout and poor communication training and like just a complete inability to develop a meaningful self-care plan. And even the way that we approach our work is sort of, you're like on a one-way trip to burnout. And how can we sort of help people step back and say, like, so what are the stories you're telling about what your work does and your role in society, and how is it that you're setting yourself up to burnout just by the way you think about what you do? And where are you missing opportunities to really get to know the people that you're serving? And so almost all the training we do, I would say maybe 10% of our training is about these. The rest of it is really about these and our brains and our hearts, and sort of how all that comes together to make you a sustainable and effective care provider, whatever kind of care you provide.
So very much looking
because
at
I am a science
practice-
nerd. Oh, sorry, Dave. Because I'm a science nerd, I do have to jump in there and say, Healwell also does research.
That's true. We do also do research. That was, when we started, we saw that there wasn't enough massage in hospitals. And we realized that that was because massage therapists aren't properly trained to belong in a hospital. There's not enough research to show that it's an effective, low cost, low risk intervention. And we just didn't have we haven't created the inroads. So we set up service programs in hospitals. We educate therapists so that they can be in those spaces and make that value added contribution. And then we work to develop innovative research that doesn't just sort of say, if I rub you, your pain goes away. We're really looking at the multifactorial experience of illness. And if I can increase your sense of peacefulness, what does that do? That is important. And that actually creates a cascade of events that support the rest of the care team and your overall care trajectory. So really getting away from those single data point understandings of what happens when one person kindly touches another person, and inviting the research to really look at what's the value of massage therapists, not just of massage therapy, because anybody can rub, but a properly trained massage therapist brings a different value to the picture than just your Aunt Tilly coming in to rub, which if your Aunt Tilly can come and rub you when you're in the hospital, she should. But when you bring a massage therapist in who has access to your electronic medical record and can talk with the other members of your care team, that changes the way that your care looks. And so that's the kind of research we try to conduct.
We've had, in my state in Australia, we've had some amazing success of integrating massage into, particularly on the oncology field. You may have seen the movie Grease. Remember Grease?
Yeah.
Oh yeah.
Okay. So the star of the show, apart from John Travolta, was Olivia Newton-John. So she's very much an advocate for natural therapies involved in oncology. And we've got an organisation here called Oncology Massage, which train therapists specifically as well in the field of oncology massage. But Olivia Newton-John has her own wing, was set up at one of the hospitals here in Melbourne. So there's a lot of massage therapy that takes place there in that cancer field. We've also got Peter Mac Hospital in Parkville in Melbourne as well, And we've had interviews with Ronna Moore before, who's
Oh, yeah.
one of the massage therapists. Oh, you know Ronna? Yeah, okay, cool.
Yeah, well, I've actually had the lucky opportunity to come to Canberra and Melbourne and do some end-of-life training and some oncology massage training. So I know those therapists who work at the Olivia Newton-John Cancer Center, and they're lovely humans.
Brilliant, absolutely. Yeah. Okay, so it's great to hear that. I told you my little story about my mum. So it's an important part, and it has profound effects on people. From like you said, the importance of just touch and yeah, it doesn't. You don't have to be fixing a muscle or a joint. It can be the touch, and it can be that relationship, that practitioner-patient relationship that helps people. And there are a lot of, well, not a lot, but there are other presenters in Australia who present specifically on end of life, and I think that's absolutely brilliant. So it's great. Yeah. Hey, Cathy, just one last point about we're going to swing across to scar tissue now, which is one of my passions. So the three-part series on the ABMP online portal. Did you want to just briefly explain to the folks at home what you cover in that particular course?
Yeah, I mean, that series is taken right out of the book that Nancy and I co-authored and the in-person courses that we teach. And essentially the main reason that Nancy and I, well, a lot of reasons, but one of the main reasons we decided to write the book is that we found as practitioners, most of the scar tissue courses that are out there are what to do about after the fact. Once a person has, down the road showing signs and symptoms of having some kind of issue that can be traced back to some kind of problematic scar tissue. And one of the things that we wanted to bring to the forefront is how can we work with patients post-surgically in the early stages of development to help temper or prevent fibrosis or problematic scars from happening in the first place, or decrease the amount of, havoc that they're going to wreak. So that's part of what the course covers is the foundational science of wound healing, just so people really understand what's happening in the various stages and when it's appropriate and how it's appropriate to use our hands to support the process, not interfere with the process. And for me, I think one of the things I'm most vocal about, and one of the things that'll really kind of send me off the rails is if I hear people say breaking down scar tissues, because that just drives me crazy, because it's impossible. We cannot break this stuff down. So I just wrote an article for ABMP back in the summer called Scar Tissue, not breakable, but changeable, and just talking about how we can use our hands to shift or change what's happening in there, because we cannot break it down, folks. It's too strong.
So if people want to find a little bit more out about those online courses, Cathy, whereabouts do they go?
So ABMP for the 3-part scar tissue management course, and Heal Well for the 5-part exploring fascia course. And in Heal Well's course, I do talk about scar tissue as well. Okay,
fantastic. And what's the Heal Well website address?
For our online courses, it's online.healwell.org. So they're all there, and we've got we actually have a couple of hospital-based intro courses and oncology massage intro courses with ABMP as well, and then we've got a pediatric hospital-based pediatric massage course bundle, and we've got a couple of other bundles in there that really support practitioners who want to get into those sort of clinical settings and just consider those issues that just aren't covered in your basic massage education.
Fantastic. Obviously a gap that's been well met by you guys. So it's great that it's happening. Just to finish up, we mentioned the podcast, which is now called Interdisciplinary. Yeah. So again, that can be found on all the app stores for you guys to check out. And I'm assuming all the past episodes are there as well for people to look at or hear.
Yeah, if you want to see our season from last year, that's still called Massage Therapy Without Borders, and all those episodes will still be up on Apple Podcasts and all the places. But our new season, we just recorded our 2nd episode of Interdisciplinary. Our first episode, we had a couple of ICU nurses share their experience with us. And we had a woman with us today who is a massage therapist who's organized a Facebook group for African-American massage therapists to be able to kind of talk about what's it like to be a Black person and a massage therapist. And it's not amazing. So she shared with us a little bit about that.
And just really quickly, because I love Australia, I'm going to be doing a presentation for the Breast Cancer Rehab and Wellness Symposium or Summit, Breast Cancer Rehab and Wellness Summit that is hosted by Denise Stewart, who is an Australian occupational therapist. That's coming up, I believe, in February.
Wow, fantastic. Any other plugs, guys? Anything else that you want to throw around there for everyone at home?
Oh,
well,
man.
your association.
Yeah, well, exactly. Yeah, stick with Massage and Myotherapy Australia, and if you go to those other links we told you about, you'll find all the other fun stuff. Oh, we do actually have one thing that I didn't mention specifically. HealWell launched a couple months ago a private online interdisciplinary community. So to escape from the rancor of Facebook and to really have more intimate and detailed conversations about social justice in healthcare, about COVID, about massage in the hospital,
fascia and scars and lymphatic.
That's right. We have an end of life section in there. So people can check that out at community.healwell.org. So come on in.
Right. Is there anything that's not up there?
No, that's it.
Sounds like you cover it all.
We're all over it.
That's it. Cal, Cathy, thank you so much for spending a little bit of time here today with the folks in Australia at our association for Connect. And hopefully at some stage, we might get you guys on for a webinar or 10 with the association. We'll try and build up some topics around what you guys are experts at, which seems to be a lot. So
I'm in. I'm in.
So congratulations.
No, thank you for having us.
Everyone at home, thanks so much for listening, and we'll see you next time.